Hi, I'm Dr. Munshi. In this video, I'm going to talk about what is BDS course. The full form of BDS is Bachelor of Dental Surgery. It's 5 years course. 4 years are academic years, and the 5th year is internship. BDS, Bachelor of Dental Surgery, deals with dental disease, oral disease, and the parts of head neck diseases. So this is a super specialized course, you can say. From the first year, you'll be focused in the oral dental diseases of the head, neck, face, etc. So this is a specialized course, and do not think that you'll not have any knowledge about the generalized disease. You'll have a fair amount of knowledge of all the diseases, all the heart disease, all the neural disease, all the endocrine disease, because everything is linked to one another. If you are suffering from stomach disease, ulcer, that will reflect in your tongue. So as a dental surgeon, you'll have to know that this tongue disease, the origination of this tongue disease from the stomach, and you'll have to refer to the patient to the gastroenterologist. So do not think that in this course, dental course, you will have knowledge about only dental disease. That is not true. You'll have all the knowledge of all the diseases, because all are linked to one another. And if you see the course curriculum, you'll understand easily. Now I cleared the idea about what you will deal with this course. You'll deal with your general disease as well as especially dental disease, oral disease, and the diseases of the head and neck. Now the first year consists of the subjects are anatomy, that is general anatomy, all the body parts you have to learn here. Physiology, that is general physiology, biochemistry, and there will be one additional dental subject, that is dental anatomy and histology. So there will be 4 subjects. Here you will have the basic idea about the body, the normal structures of the body, normal physiology, how body functions normally, how the enzymes works, where this bone is located, where this nerve is located, where the artery is located. You will understand in this year. That is the normal structures, normal functions of the body you will learn here. Now the second year, the subjects are general pathology, microbiology, general pharmacology. These 3 are medical subjects. Now the dental subjects: dental materials, preclinical prosthodontics, preclinical conservative dentistry. So second year is a little bit tough because lots of subjects are there. That this is the very much important year, because here you will learn about the abnormality of the body. The first year you learn the normal functions of the body, and the second year you will learn the abnormal functions of the body by reading pathology. Pathology means disease process. Microbiology means bacteria, viruses, fungi, how they affect our body, and pharmacology, that deals with the drugs, how they act in our body, in what disease, what drugs you'll have to prescribe, and what are the doses of the drug and how the drug acts actually. And in dental materials, you'll introduce various materials, because dentistry is depends upon the materials also, because you'll have to fill the tooth, you'll have to do root canal treatment, you will have these, that, all the materials you have to use. You have to have the fair idea about the materials that you will use in your future. So these subjects are also very much important. And preclinical prosthodontics and preclinical conservative dentistry, these are the introduction of the dental subjects. Preclinical means you will not work in the patient, you will work in the dummy. Prosthodontics mean replacing tooth, replacing your oral structures. Sometimes ear is missing, replacement of these. Sometimes nose is missing in patients after surgery or any accident. These things also have to replace. These all things comes under the prosthodontics domain, and in the second year the students will do these things in dummy. And the conservative dentistry deals with the filling part, restoration part, caries lesion. You have to excavate, you have to remove the caries lesion, and you have to fill. These all things the students will do in the dummy. So these are the second year. And in the third year, the subjects are general medicine, general surgery, and one additional dental subject, that is oral pathology. I don't have to discuss about what is medicine. You will all know, in medicine you have to diagnose the disease, you have to treat the disease, general disease. In the surgery, you have to diagnose what is the problem of which system and do the surgery. And in oral pathology means if there is any lesion, if there is any suspicious lesion in oral cavity, you have to take that tissue from that area, and you have to examine under microscope. That is the domain of the oral pathology mainly. Now this year is also very much important, clinical perspectives. And this third year, with these three subjects, the students will go into the practical domain of actual practical domain. That means patient will work with the the students will work with patients in third year. Different dental works are there. They will start doing things slowly. So from third year, students will go into the departments and do actual patient work, starting and they will under the supervision of the teachers or professors or faculties present in the department. So from third year, you will have the experience of dealing with patients. In the final year, here all the subjects will be dental subjects, and you will have lots of patient exposure in this year. And the subjects are oral and maxillofacial surgery. These subjects will deal with all the surgical work inside your oral cavity, in your face, head and neck area, cancer, tumor, fractures, and tooth extraction, surgical extraction of tooth. All the surgical work will be in the domain of oral and maxillofacial surgery. Prosthodontics, I have talked about it. In second year, you will do the preclinical prosthodontics, and in final year, you will do clinical prosthodontics. That means you will work actual patient, and the domain deals with the replacement of missing tooth, replacement of missing parts of your face, including nose, ear, orbit, etc. Now the conservative dentistry will deal with conservative and endodontics. These subjects will deal with the filling part, filling and root canal treatment, and many other part also. So oral and maxillofacial surgery, one subject. Second is prosthodontics. Third is conservative dentistry and endodontics. Fourth is periodontics. These subjects deals with the diseases of the gum, and also the diseases of the structures that surrounds the tooth, gum, alveolar bone. You will learn if you learn the course, but in grossly it's deals with the diseases of the gum. That is all. Next, child dentistry, this is pedodontics. These subjects will deal with the dentistry, especially in children. Pedodontics. Next subject is orthodontics. Orthodontics will deal with the shape of the face. If there is any discrepancy of the jaws, if there is any deformation of the face, if there is any irregularity of the tooth, this all will be dealt in this orthodontics. So these are the subjects that will be learned in final year. And this year you will do practical works, patient works, along with that academics. So this is little bit a hectic year, and This is a very, very important year for dentistry. You will learn lots of things in dentistry. Now the 5th year, that is internship. We say this the rotatory internship. Rotatory means you will have to work every department that I just said in the final subjects. You will have to work all the departments in 1 month, 2 month, like this time period. So this subjects, this year internship will work on patients only. You will learn the practical works very much, what do I say, perfectly, and you'll don't have to give any exams. So these were the subjects and course curriculums of dentistry. You will learn lots of things. You will learn all dental diseases. You will learn head neck diseases. You will link the oral diseases with general diseases, and you will have the knowledge about the general diseases as well as the diseases of the head and neck. So this is a fantastic course. Now, what are the future prospects of it? I'll discuss in other videos. So thank you very much for patiently listening. Hope this video will be helpful for you.